To the coronavirus crisis in Indiana, another day with more than 1,000 confirmed COVID-19 cases. It brings the Hoosier State to 121,000 in all. The death count just over 3,400 after 18 new deaths reported. And while the positivity rates are going down in many counties statewide, the spread rate of the virus has health officials concerned. Indiana now ranks as the fourth worst state in the country when it comes to the spread of coronavirus. CBS 4's Darius Johnson explains what the numbers mean and how Hoosiers should respond.
There are a number of factors that contribute to this data as Indiana moves into phase 5, but some are warning people not to let your guard down.
First, the thing that could contribute to it, of course, is Labor Day. It's been about 3 weeks since that happened. And we see that generally after a major holiday, I think kids in school could be a reason.
According to the director of public health informatics at Regent Street, Brian Dixon, these are several factors that could have caused a spike in Indiana's reproduction numbers, or are not. At one point, the Hoosier State was 6th best, according to the data from the COVID-19 tracking project. Now Indiana is the 4th worst.
I think what the data are telling us is that people are starting to kind of go back more to normal activities.
Indiana is now in phase 5, the final phase of reopening. Yesterday, the governor emphasized just because the virus is spreading doesn't mean we're backtracking.
What we need to do to be extra vigilant, but it doesn't mean that we go back to 4.5 or 4. It means we need to hunker down in the areas where we see spread.
However, Dixon says while things looked okay when the decision was made, the state might have acted too fast.
I do think that potentially we are moving ahead maybe a little bit sooner than what we should have.
Dixon added it's important for people to keep safety precautions in place, especially over the holidays, something State Health Commissioner Dr. Christina Box also stressed to Hoosiers.
The need for us to continue wearing our masks, washing our hands, socially distance, not going to work or school if you're sick, getting tested, and engaging with our contact tracers. That's how we prevent the spread.
Dixon tells me we should also be watching the number of cases daily, the positivity rate, and the number of tests that are being performed. He says within the last 2 weeks, those number of tests being performed went down as schools have only started conducting surveillance testing. Reporting in the newsroom this evening, I'm Darius Johnson.
Darius, thank you. Regent Street is teaming up with Indiana Pandemic Information Collaborative to offer some free classes on various topics regarding COVID-19. Every Thursday, starting next week, health officials will break down aspects of COVID-19 from the symptoms to the impact on minority communities and future preparations. Now, if you're interested in registering for the class, visit cbs4indy.com.